The first step is to open your web browser. In this case, I'm using Firefox. Any browser such as Chrome, Internet Explorer, or Safari should also work. Then go to drevidence.com. Click the Login button on the top right. Then select Client Access. Next, select Doc Evidence Login. Enter your login information and click Login. You will be taken directly to your database. The landing page provides a general overview of your customized database. The general scope includes the framed question that is answered by the data in your portal. In this case, we will be looking at evidence from clinical studies on the efficiency of treatments for localized prostate cancer. Next, you can click on Expand to see the types of studies that are in the database, including number of studies, types of studies, and number of comparisons. Click Expand to further view the breakdown. Here, you are able to see the number of treatment groups and subdesigns. Next are the inclusion and exclusion criteria, which means the types of studies that were retrieved and analyzed in your database. Please review the glossary of terms on the Qure website as needed. First, you see the types of studies that were included in this database. Next, you see the types of patients and/or participants that are in the studies. Then the names of the therapies and/or interventions in the studies. Then the therapies that they are being compared to. And finally, you can see the specific outcomes that were extracted and analyzed from the studies. This information is referred to as PICO. To view your specific search protocol, click on the P button on the top corner of the landing page. The search protocol is the inclusion-exclusion criteria for this custom database. Additional information is listed below the PICO information. The studies list can be found in the Studies menu. The study list provides a list of all of the studies in the database. In this case, there are 15 total studies. As you can see, the first column tells you the author, the second column tells you the study name, and the third column allows you to go in and to view the study summary. To access a study summary, simply click on the magnifying glass. A study summary is a digital summary of each study in your database. Note that we only collect specific data from each study. This data collection is custom ordered by the client. Here is an example of a full text article. As you can see, these articles are long, complex, and difficult to interpret. The digital study summaries are user-friendly versions of these full-text articles. Back to the study summary. First, you can see the author and title. Then, within the study profile, you can see the study design, the sub-design, the mean follow-up, and other important information. The follow-up is critical. This data tells you how long the patients were followed after undergoing the specific interventions. Longer follow-up is always better. Patient characteristics provide the baseline characteristics of the patients in each treatment group. The first column is for open radical prostatectomy. The second column is for patients who underwent no treatment. You can click on the blue terms to expand and see the baseline characteristics of the patients in each group. The number of participants, their average age, their PSA score, their Gleason score. PSA and Gleason score are scores particular to localized prostate cancer. Again, each database is customized and the baseline patient data will be specific to each client's needs or preferences. Now you can view the outcomes, or what happened to the patients in each group. Click on the blue terms to expand the outcome. Although this database includes outcomes such as mortality and metastatic local progression, This study only has mortality data. The mortality outcomes are broken down into other reasons, unknown cause, all cause, and prostate cancer with 2 columns, the first one being for open radical prostatectomy, the second one for no treatment. You are also able to view a bar graph image for each outcome by clicking the graph icon. The blue group is the open radical prostatectomy group. In this case, 6% died due to prostate cancer in a mean follow-up of 13.3 years, while 16% of the no treatment group died due to prostate cancer after 13.3 years. The study summary is like a virtual waiting room. You can see if the patients have a similar medical or demographic history. Then you can see what happened to the patients after undergoing specific therapies for a certain length of time. Each study summary is a different waiting room of patients. If you want to find out the names and/or locations of the physicians who treated these patients, then click on the abstract or click on the full text if the full text is available. The abstract and full text are located on the top right of the screen. The authors who conducted the study are the first place to go to find specific names of physicians. The institution will show you the location where the study took place. You can search these authors and institutions to track down the physicians. The meta-analysis tool can be accessed in the Studies menu. The meta-analysis tool enables you to pull results and data from multiple studies. In other words, you can find out what happened to all the patients at one time by adding up the event. This pooled data enables you to calculate the true difference of effect between 2 treatment groups from a much larger group of patients. For example, we are looking at localized prostate cancer. You can compare one kind of treatment to another kind of treatment to determine which therapy is more effective for a specific outcome. Or in this custom database, you can compare one kind of treatment to no treatment. Step 1 is to choose groups of interest for pooling comparison. Treatments are organized in the left panel. Click on the triangle to view the nested folders. The second step is to drag and drop the treatments of interest into the appropriate boxes. In this example, we will drag and drop the therapy called prostatectomy, and then drag and drop no treatment / active surveillance, which will now enable the software tool to pool studies on prostatectomy versus no treatment or active surveillance. Then click Submit to view studies that are on these therapies. There are 8 studies found in this comparison. You have the option to choose placebo / usual care or active control by checking these boxes. You are also able to manually select studies. Placebo means that a procedure was done, however, the procedure had no effect. Active control means that no treatment was done and the patient was simply monitored. I will choose both of these boxes. Click Submit to view the outcomes for analysis. The default outcome given is local progression of prostate cancer. However, you can change the outcomes you want to analyze. Use the drop-down menus to select different outcomes. For clinical outcomes, we can choose local progression, deferred radical prostatectomy, or metastases. We can also choose mortality. For type, we will choose prostate cancer. However, you have the choice to choose all-cause mortality, adverse events, Alzheimer's disease, etc. The efficacy statements are automatically generated by the software. The evidence shows that mortality due to prostate cancer, 8.2 years to 20.2 years follow-up, was 58% less likely in those that used open radical prostatectomy compared with those that were using comparator. In this case, the intervention was open radical prostatectomy, and the comparator was active surveillance or no treatment. A number need to treat statement is also generated, but has limited value for patients and doctors. This need to treat statement is used by economic specialists. Below the statements are the lists of studies used to generate this evidence. This column always refers to the intervention, in this case, open radical prostatectomy. This column always refers to the comparator, in this case, active surveillance or no treatment. The first number in the intervention and comparator boxes always refer to the patients who died due to prostate cancer. The second number always refers to the total number of patients in the study. The percentage below refers to the percentage of patients who died due to prostate cancer. For example, in the first study, we can see that 56 patients out of 3,399 died due to prostate cancer. That translates to 1.6% of the total participants in that study died due to prostate cancer. While in the comparator group, 58 out of 2,021 patients died due to prostate cancer. That translates to 2.9% of the total patients in the study dying due to prostate cancer. To exclude a study from analysis, uncheck the box and click Recalculate. A new efficacy statement will be generated. Additionally, the last row is the most important data in the meta-analysis tool. This is the pooled data for all the patients in all the relevant studies. We can see that out of 42,616 patients, 642 of them died due to prostate cancer. This translates to 1.51%, while in the comparator group, out of 23,401 patients, 1,124 died due to prostate cancer. This translates to 4.8%. So we can see that the total absolute difference between these two groups is 3.3%. In other words, 3.3% more patients survived in the radical prostatectomy treatment group compared to no treatment. Now you have data from each study, and you also have the pooled data. Patients use this data in consultations with physicians to make an informed decision. And physicians use this data to make evidence-based recommendations. Evidence is in the eye of the beholder. The Qure provides the data and the evidence. You take this data to make an informed decision. Note that the meta-analysis group allows you to pool results to better understand the effectiveness of treatments. You can also get back to the study summary by clicking the magnifying glass in the View column. For any additional questions, please contact the Qure.